Welcome to another MU Healthcare Y107 Ask the Expert podcast. And with October being Breast Cancer Awareness Month, our expert today is MU Healthcare Radiologist Terry Elwig from Ellis Fischel Cancer Center. What advice do you have for women who have been putting off a mammogram?
I think the most important thing for women is to be proactive, to take your own health into your own hands. Talk with your primary care provider about your potential risks. All women should have a risk assessment sometime between the ages of 25 and 30 to determine if they might be high risk. If you are, we're going to recommend additional screening before the age of 40. Other women who don't have any known risk factors, we still recommend mammography beginning at the age of 40 and continuing annually until your life expectancy is less than 10 years. So be proactive. Talk to your doctor, come up with a plan that works for you and that you can continue doing the rest of your life.
Doctor, why is early detection so crucial, so important?
Early detection of breast cancer is the way we can actually save lives and cure breast cancer. Breast cancers that are found on a mammogram, in most instances, are extremely small, subtle cancers that can be cured. You can cure cancer that's confined to the breast tissue, hasn't spread to the lymph nodes, and therefore hasn't metastasized to the rest of the body. Some of the larger cancers that even have spread to one or two lymph nodes can still be cured, and we want to catch those cancers in that stage before they spread to the rest of the body. And the only way we can really do that is with mammography.
It's our Ask the Expert podcast with Breast Cancer Awareness Month on. The radiologist Terry Elwig, our expert with us on the podcast here today. Who is most at risk for breast cancer? And let me ask you this too. How can you lessen your risk?
Okay, the risk of breast cancer is somewhat genetic. So we know there's a subtype of our population that carries the genetic potential to develop breast cancer. But the majority of women who develop breast cancer have no risks, no family history. So it's a disease that's common among women. So just being a female makes you at risk. 1 in 8 women will develop breast cancer sometime during their life. Lifestyle choices, obesity, poor diet, having dense breast tissue, those are all things that will add into the risk equation. And everyone should have that risk assessment at some point once they start having mammograms.
To discover your own personal risk factors for breast cancer, take MU Healthcare's Breast Cancer Risk Assessment. Go to muhealth.org/breast cancer risk. What do you say to women who are nervous about a mammogram and the thought of getting a concerning phone call later?
A lot of women are very concerned. Maybe they've had a recent diagnosis in their family. Maybe they have a family history, and they're extremely nervous to the point that sometimes they put off having their mammogram because they're afraid that they might have cancer. Other women come get their mammogram every year because they know they don't have cancer and they just want to prove that. So that subset of women that's extremely anxious, we try to tell them, the callback rate is low. And when we do get a call back, the majority of those are benign. We're just doing our job, being extremely cautious, looking very carefully. And once you come back, we'll tell you exactly what we're doing, exactly what we see, and let you know that very day if there is anything suspicious that might require a biopsy. The majority of people will go on their way knowing that they have no abnormalities, no signs of cancer.
How have advances in breast cancer treatment provided more hope for those that are diagnosed?
If you've been diagnosed with breast cancer, the good news is that the majority of the cancers we diagnose can be cured. We diagnose those at such an early stage that we can cure those. But even for those women who come in with more advanced stage cancer, we've developed much better targeted therapies, not such harsh chemotherapy that we'd used in the past. Immune modulation, hormone modulation, things that are much gentler on the body and less stressful for the patient.
To discover your own personal risk factors for breast cancer, take MU Healthcare's Breast Cancer Risk Assessment. Go to muhealth.org/breast cancer risk.